I'm a health services researcher at Health Technology Wales, and since I joined over the summer, I've been leading on our social care work. And hopefully today I can give just a brief overview of the background to Health Technology Wales, the role that we have within Wales, and then to talk a little bit about how we've responded to the pandemic and how we plan to address social care in our work more over the coming months and years. So in 2014, the Welsh Government had an inquiry called the Access to Medical Technologies in Wales inquiry, and it highlighted that non-medicines technologies required greater support. So it recognised that drugs have a much more formal way for evidence to be assessed and then supported for use for patients if they're shown to be effective, whereas that process for non-medicines technologies is much more vague, and you may well end up with non-medicines technologies which are highly effective cost effective, but patients don't gain access to them. And so that report acknowledged that that was an area that needed to be addressed in Wales. And so in 2017, Health Technology Wales was set up to provide an all-Wales approach to assessing the value of non-medicines technologies in both health and social care. And we use a structured approach to identify topics that are of a high priority for Wales. So they can come from people working in the health sector, the social care sector, or we welcome them from individual clinicians, carers, and people receiving care as well. And then we make an assessment of whether an appraisal by Health Technology Wales can provide supporting evidence on clinical or cost effectiveness. And then we provide guidance on use and make recommendations on whether technologies have enough supporting evidence and would improve patient benefits or benefits for people using social care, and whether they could be recommended. And so we work with the health boards, the specialist trusts like Velindre, the Welsh Ambulance Trust, and regional partnership boards involved in social care to promote and then monitor the uptake of recommended technologies. And so our work sits in a wider context, which is called health technology assessment. So that's what Health Technology Wales does. We use the health technology assessment model. And this is the internationally recognized definition. So a multidisciplinary process that uses explicit methods to determine the value of the health technology with the purpose of informing decision-making to try and ensure that evidence-based decisions are being made that provide an equitable, efficient, and high-quality health system. There are a couple of things about that definition and our name that I want to highlight. So I've put an asterisk by health. Health technology assessment as a wider field refers only to health. We are very clear that we are considering both health and social care interventions, and they fit within our remit. So our partner NICE in England is the same. They would consider social care as well as health and social, as well as health. Other international bodies and the wider field sometimes doesn't refer to those. So that's why the definition relates to health more specifically. And technologies as well. So sometimes when people hear technology, they immediately think of the things that relate most to that word in general use. So you might think of medical devices, things which are used in surgery, or apps or IT solutions. The definition of technology in this context is much broader. So we would also consider things that are more people-based. So things around physiotherapy or psychological therapy would come under health technology as a non-medicines technology, and things like pathways and transitions to care would also come under this definition. So that's something that we always want to make clear when we talk about Health Technology Wales, that we're for both health and social care, and we have a very broad definition of non-medicines technologies. So I've included this wheel on the right, which shows what we think about when we do appraisals of different technologies. So we think of the area of social care that it's in, whether there are any unmet needs, what other interventions might be available, and if it's a high priority to be dealt with within the Welsh context. We think about the technologies or interventions which are being recommended, and whether there are any specific issues with the technologies that we need to think about. A really key thing is looking at the effectiveness. So we need to look at what evidence there is that these technologies work or don't work. And that's a really key thing within our assessments. We use the kind of systematic review methods that were described earlier. So rather than doing primary research, and that's something that we really look at. And then we also need to think about cost effectiveness. So we're more than happy to recommend things which are more expensive as long as they deliver patient benefit. There needs to be an assessment of that process. And we look at things like organizational and patient issues. So thinking about how will this fit in the Welsh context. And so as you can imagine, our work has been really interrupted by the pandemic. And we refocused a lot of our efforts to think about how we could provide support to the Welsh Government and Four Nations committees. I think the pandemic really highlighted the need for a more evidence-based approach to non-medicines technologies. So in that period, while we were waiting for drugs to be developed or vaccines to be developed, there was a period where non-medicines became really important to think about. And we had 3 key strands relating to that related to older adults. So we were looking at test accuracy, how things related to PCR testing, which takes longer, and whether there were other solutions which could provide quicker results, but would also provide assurance to health professionals or people working within social care that they were safe to work in their environments. And we also looked at PPE effectiveness, so both the masks in the community, but also whether in that period where there was high demand for PPE and procurement was struggling, whether PPE could be reprocessed and so reused and fill those gaps in procurement data as lots of different countries rushed to try and get PPE. And we also looked at convalescent plasma therapy. So this is a non-medicines intervention where you take plasma from a person who has had and recovered from COVID and give it to someone who is struggling for their immune system to deal with the early stages of COVID. And the idea is that providing antibodies through someone else's plasma can help kickstart someone's immune system and can help them recover from the disease. And so the evidence that we have at the moment suggests that for people who have already been hospitalized, convalescent plasma isn't enough to allow them to recover. The disease of COVID is already too well progressed. But we continue to work with the Welsh Blood Service to look at whether much earlier use of convalescent plasma for high-risk groups, so older adults who haven't received vaccinations or those who have received vaccinations but have risk factors, which means they're still at high risk of adverse outcomes. And so we're continuing over the future and as the pandemic eases but is still present to look at whether we could use convalescent plasma in a very focused way in the very, very early stages of COVID, possibly in the days after contact, to see whether that could improve people's outcomes and make sure that in addition to things like vaccines and other drugs which are now coming online, whether there are other interventions we can use. So that's been how we've been responding over the last 12 months. And into the future, we're very keen to make sure that social care is a priority for us and that we're taking on more and more appraisals within social care so that we can provide evidence in this field. So I think the pandemic really reinforced that social care required greater focus. I've worked in research in social care and mental health at the start of my career, and people who work in this area know incredibly well that social care needs greater focus. I think before the pandemic and certainly during the pandemic, people in the wider health and social care or policy context, politicians, other people working across policy have developed that awareness that people working in social care have always had. And HDW is working with Social Care Wales to make sure that we're developing our appraisal program and doing assessments within social care, which are providing impact. That work actually started early last year and then was paused due to the pandemic, but we're really picking that up now to make sure as we go forward, we're supporting change in that area. One thing which Social Care Wales highlighted to us as a priority was support for carers of people with dementia who are experiencing mental health problems. So this really relates to what Jill was presenting on in the previous presentation. Social Care Wales highlighted to us the Strategies for Relatives programme, which provides individualised therapist support for carers. But we have also become aware by working with people in Bangor through Health Technology Wales of the iSupport programme. And so I've listed Strategies for Relatives there in the slide, but we are really keen to make sure that we do a good assessment that involves iSupport too, so that we can look at the different types of programmes which would be available for people who are carers of people with dementia. And I think as people have touched on in the previous presentations in the chat, there has been this big increase in video conferencing over the last year. And so it could make delivery of these types of interventions with a therapist providing individualized support more viable, because the type of previously they've been delivered with a therapist traveling between people's homes to deliver them. And obviously then there's time that takes to travel between homes. The increase in video conferencing might mean that you could provide a much higher volume of service to people because that time is removed. But we are also aware that that approach may exclude people who don't have access to video conferencing, and there may be some change in the effectiveness of the intervention based on the fact that it has moved from being delivered face-to-face to online. And so START is now being appraised, and similar programs are being appraised by Health Technology Wales. And we'll consider the supporting evidence for each of the programs that we come across using those kind of structured systematic review methods and working with experts to get input. And alongside, I'm looking at the effectiveness and cost effectiveness, we'll consider issues around equity that people have talked about to make sure that there's equal access. And also it's been highlighted to us that there might be issues with the psychology workforce in Wales. So it would be great to have individual therapists working with people, but if it's not possible to recruit psychologists into those roles, then an intervention like iSupport, which uses an online platform, may be more appropriate and more viable within Wales. So hopefully I've given a quick run through of our background and our work. If what we do sounds like it might be of interest and you have a technology or an intervention that you think has evidence that isn't used widely across Wales or has variation in use, we'd be really keen for people to bring them forward to us. So we have a suggested topic section on our website that I can post in the chat, but we're also welcome, people are also welcome to email me and get in touch and flag those. We also rely heavily on expert advice in our appraisals to make sure that we're reflecting the evidence and considering issues around the technologies we're appraising. So again, if people are interested in acting as experts, we'd be very keen for people to get in touch. And our website has all of our previous appraisals and guidance. So if people are interested in what we do, people are welcome to look and see if there are things of interest. Over the coming months and years, we hope that we have more and more social care topics. And so we would become more and more relevant to forums such as this.